The Barrier Breakers Advocacy Group was established in 2020 in response to the COVID-19 pandemic. According to Human Rights Watch 2020, this pandemic can potentially thrust vulnerable children into adverse experiences with child labor, sexual exploitation, teenage pregnancy, and child marriage. While we have seen evident strides with the education, health, and social service ministries in the region, we, the BBAG, are advocating for an intersectoral approach to combating COVID-19. At the heart of our group are our able child advocates. Our Chief Operating Officer, Ms. Christiana Lucky, as well as our Community Affairs personnel, Mrs. Suzanne Patois, joins us from Trinidad and Tobago. Ms. Kristen Jeffries, our Budget and Finance Director, joins us from St. Kitts and Nevis. Lastly, our Executive Director, Mrs. Jacqueline Molina, joins us from Belize. We, the Barrier Breakers Advocacy Group, are a product of the Caribbean region, and together
we represent the voices of all vulnerable, marginalized, and poverty-stricken children.
We work to aid children and families with fundamental health and education necessities.
We fight to prevent COVID from becoming a child rights crisis.
And we partner with collaborators to co-create life-changing interventions for vulnerable children and their families.
COVID-19 has caused 1. Education disruption and inaccessibility, where families may not have the tools to access online education or even the family support. 2. Rise in unemployment, where families have job loss, work hours have reduced, and this have increased the unemployment rate. 3. Strained income, where one person income or no income to support their families. 4. Food insecurity. Food prices are rising higher than other basic items, where families are unable to buy even the basic items to feed their children. If this continues, could lead to a hunger pandemic. 5. Halt on social inaccessibility. Quality health care, social protection with domestic abuse, income security, and other essential services. And 6. Improper childcare. Children are left unattended, where their physical and emotional needs are neglected. Some even are exposed to abuse in the home. Prevention is the most important action one can take to protect yourself and your family from COVID-19. The Ministry of Health is responsible for the health of the citizens and to ensure that all organizations and institutions conform to standard safety. The need to provide the general public with accurate information and keeping people connected is very important. This can be done by radio, television, Facebook, WhatsApp. Children and their families are suffering greatly from basic social services and access to health and food. Their living conditions are of high risk because they often lack the basic amenities to maintain preventative hygiene and health care because of financial constraints. If the risk is not minimized in these communities, then it may become quite difficult to reduce the spread to the broader communities. The Ministry of Health is calling on families to adhere to the following. Talk to your children about the COVID pandemic. They are not too young to learn. Create a contact list of healthcare services, friends, teachers, employers, etc. Wear masks at all times when outdoors. Wash hands and sanitize, and don't forget social distancing. Ministry of Health to continue providing the free health nutrition programs at the community health centers. This is geared to promote healthy eating, particularly for low-income families. Social development and non-governmental organizations such as churches have given out food basket, masks, hand sanitizers, and basic medical supplies to vulnerable families in the communities. There should be home visits in some communities by healthcare workers to strengthen link with families who need them. The delivery of CDAP medication for the elderly who cannot visit the health centers, pregnant mothers and mothers with children, particularly under 5 years old, and those families with special needs children should also be given into consideration. There are multi-agencies who are working with struggling families during this crisis to obtain basic items such as diapers, medical supplies, and income support.
Regional responses to education. 1. Provide educational packages for children. Children were given take-home packages containing academic activities. 2. Implement distance/online learning. Schools have been using Zoom, Microsoft Teams, and Google Classroom to deliver instruction while away from the physical classroom. 3. Assist with tablets and internet installation for less fortunate families. For many families who could not afford technological resources, the Ministry of Education provided these for students and even partnered with other agencies in order to provide technological relief. 4. Offer counseling to cope with COVID-19. The Ministry of Education used its guidance counselors in order to aid families who were going through difficult times. 5. Evade duty on computers for teachers. Teachers were offered tax exemptions on computers and tablets that were to be used to conduct online classes.
Regional government responses to help vulnerable families in the Caribbean during the COVID-19 pandemic. The U.S. government is providing financial assistance and technical support to multiple Caribbean nations fighting COVID-19. The U.S. Department of Defense has distributed various medical and protective equipment, delivering thousands of face masks, shields, gloves, and protective suits to national disaster offices in Eastern Caribbean countries with support from the Caribbean Disaster Emergency Management Agency. After schools closed in Trinidad and Tobago because of COVID-19, 3 members of the 2019 Trinidad and Tobago Youth Ambassadors Program offered online tutoring sessions for free to support programs in which young leaders engage students while schools are closed. Using connections they made during their program, the students built a network of 30 tutors from several countries to help over 4,000 students in the Caribbean maintain their academic performance over the remainder of the school year. There was major support for the delivery of education through online platforms and support with community-level connectivity for underprivileged children. This included the provision of laptops and tablets. Grant facilities have been made available to stakeholders within the Caribbean's tourism sector. The purpose of this grant is to provide financial support to owners or operators for the upgrade of the tourism accommodation facility to assist them in recovering from the coronavirus pandemic. It will also focus on lending for good development outcomes such as job retention, for hotels that achieve better integration with local agriculture, use renewable energy, and upskill local staff. Salary relief grants. This initiative seeks to mitigate the financial challenges experienced by persons who are retrenched, terminated, or experience reduced income as a result of COVID-19. In this regard, the government is committed to provide the following financial assistance to the retrenched, terminated, or those experiencing reduced income for a period not exceeding 3 months. This includes income support, food support, and rental fee support. The PAHO and WHO regional Caribbean offices have outlined a plan of action for allocation of the funds, inclusive of training for healthcare workers, officials, and laboratory personnel, strengthening data collection and surveillance in the form of equipment and personnel, as well as implementation of risk communication plans, among other activities. Caribbean Airlines Cargo will utilize the airline's fleet of Boeing 737-800 and ATR-72 aircraft, offering up to £18,000 for the movement of essential goods to and from destinations, including but not limited to Antigua, Barbados, Curacao, Grenada, Guyana, Jamaica, Nassau, St. Lucia, St. Martin, St. Vincent, Suriname, and Trinidad and Tobago. Charter flights will be subject to regulatory approvals of each jurisdiction and airport.
Proposal of intersectoral interventions. 1. Establish an intersectoral cadre of representatives from health, education, and human services ministries to address the impact of COVID-19 on vulnerable children and families. Each ministry has various personnel to represent them when addressing the needs of the vulnerable. By doing this, they can relay the messages to and from their respective ministries. 2. Implement an intersectoral analysis of data related to health, education, and human capital. The gathering and analyzing of data would help the various ministries to understand the number of families that need help and the various areas in which they can be assisted. 3. Allocate specific funding for intersectoral initiative to assist marginalized families in combating COVID-19. In order to assist the various families, funding must be sought from other agencies and interagencies to assist these families. 4. Establish an action plan that enables suitable aid, education, and assistance for struggling families. The establishment of a plan will provide strategic actions that will be taken in order for ministries to meet their goals. The collaboration of these ministries will help to assure that children who are less fortunate receive the assistance that is desperately needed.
Based on our research from Kaplan, Dillian, Mitchell, Marsh, and Rudolph 2013, we believe that an intersectoral approach to combating COVID-19 will force duty bearers to act and intervene on behalf of vulnerable children and their marginalized families from a united standpoint. This will ensure that their decisions are made in consideration of equity, sustainability, and probability, thus ensuring that vulnerable children and marginalized families will receive the help that they desperately need through the collaboration with the right personnel. After all, though COVID-19 is mainly a health crisis, coping and recovering from the pandemic is largely dependent on the social and educational determinants of health.
Now that you are aware of
We
our fight
foresee
and have
the
been enlightened
establishment
by our
of
vision,
meaningful
we urge you to
COVID-19
join us
combating
as we
initiatives
advocate for
that will improve
comprehensive
the economy,
COVID-19 provisions
human capital,
for vulnerable
healthcare,
children and
overall
marginalized
livelihood of
Come be a
vulnerable
part of
children
this family
and their
of child
marginalized
advocates
families
and help us to continue to
through
break
an
barriers.
all-government action approach that offers them comprehensive COVID-19 resources and aid.